Friends, I am Dr. Amit Swarnakar and I am going to present in front of you regarding aplastic anemia. The discussion on aplastic anemia will be presented in front of you all in several parts because the topic is very vast and it is very difficult to upload the whole section in one video, especially in YouTube section. So let us discuss regarding what are the contents regarding aplastic anemia. So in the contents we will discuss regarding what is aplastic anemia, regarding the incidence of aplastic anemia, etiology of aplastic anemia. Under etiology section we will discuss regarding drug induced aplastic anemia, immune dysregulation in acquired aplastic anemia. We will discuss regarding dendritic cells, natural killers, genetic susceptibility, telomeres. Then we will discuss regarding viruses responsible for the cause of aplastic anemia, signs and symptoms. So let us first we come to know that what is aplastic anemia. It is a condition in which the blood stops producing new blood cells. It is a condition in which the blood stops producing new blood cells. It is a rare but serious condition and the bone marrow deformity leads to the development of this pathological condition and the body do not get enough blood cells for the maintenance of normal physiological function. The characteristic features of this disease is governed by hypoplasticity. So what is hypoplasticity? Underdevelopment or incomplete development of tissues or organs. Bone marrow become fatty. Regarding the bone marrow become fatty, a study has been conducted to study the morphological characteristics of bone marrow in aplastic anemia in over 30 participants and 20 normal adults. In this study, the characteristics morphological features were studied and the result came out that in the bone marrow of normal adults, the fat cells appeared as large spears and it is interspread among the hematopoietic tissue and nucleus was not visible in most of these fat cells. The fat cells of aplastic patient shows variation in size and shape and most showed a large eccentrically placed nucleus and a proportion of it showed one or more small inconspicuous nucleolus that is not prominent, and these data suggest that fat cells in aplastic anemia may be immature. The study has been taken from do bone marrow fat cells or their precursors have a pathogenic role in idiopathic aplastic anemia, and it is conducted by Anwarul Islam. Then other characteristic features are reduction in the hematopoietic stem or progenitor cells, and these conditions leads to development of defective mature blood cells and peripheral pancytopenia. So what is pancytopenia? A condition where there is a lower than normal number of red and white blood cells and platelets in the blood. When there is problem in the bone marrow with the blood forming stem cells, then pancytopenia develops in the body. Then we will discuss regarding incidence of aplastic anemia. The incidence of aplastic anemia varies from 1.4 to 14 cases per million populations, and the incidence is higher in Asiatic countries than the countries of the West. The present condition regarding the totality of the incidence can be marked on the basis of the socio-economic status of the population concerned. Exposure to pesticides, chemicals, toxins and the pathogens has also gained marked attention regarding the pathogenesis of aplastic anemia. In India, especially in the Lucknow region, a study has been conducted in the pediatric population and it is seen that near about 6.8 per million has been affected with aplastic anemia. In another study that is conducted in aplastic clinic of Department of Hematology of All India Institute of Medical Science, New Delhi, 1501 patients were screened from 20 different states of India and it has been seen that 28.7% of patients were from Uttar Pradesh, 23.6% from Bihar, 20% from Delhi, NCR, and 7% from Haryana. Geographic variability has been seen regarding the incidence of aplastic anemia. Among the patients with pancytopenia, the incidence of aplastic anemia varied from 10 to 52.7%. 57.14% of cases were reported from the northern district of West Bengal having the severe and moderate form of aplastic anemia. The incidence of this disease is relatively less in Europe and North America, and approximately 2 per million per year is reported in India and other Asian countries. In another study, it has been depicted that the incidence of aplastic anemia is higher in people of Asiatic region, and near about 1324 patients were included in the study. The study was conducted in Pakistan and the cases were registered at Armed Force Bone Marrow Transplantation Center, Rawalpindi, Pakistan from March 2001 till August 2016, and the study have concluded that younger age, male predominance and higher consanguinity point towards genetic factor in aplastic anemia etiology among the South Asian population. The article also has given emphasis regarding the incidence of aplastic anemia worldwide. About 3.9 million patients per million was reported in Bangkok. About 3.9 patients per million was reported in Bangkok, 5 patients per million in northeast region of Thailand, 5 per million cases were reported in Sabah, Malaysia, and 5.16 per million cases were reported in Korean children. Regarding etiology of aplastic anemia, let us first discuss today regarding the drug-induced aplastic anemia. It has been observed that the user of chloramphenicol while treating infectious disease leads to the development of fatal hematopoietic aplastic anemia. Nitrobenzene ring is present in chloramphenicol and it induces erythropoietic hypoplasia when given in heavy dose to dogs and human volunteers. And this part is taken from Epidemiology and Etiology of Aplastic Anemia, Hermans Hempel. In another study, the drug chloramphenicol has been regarded as the biggest culprit for the development of aplastic anemia, and it is seen that 1 in 20,000 patients treated with chloramphenicol used to develop aplastic anemia, and from 1950 to 1965 the chloramphenicol induces aplastic anemia accounts for 22% of the total cases. The study has been taken from the relationship of drug therapy to aplastic anemia in Pakistan, a hospital-based control study by Muhammad Asif Saeed, Therapeutics and Clinic Research Management 2021. So, what are the drugs reported to cause aplastic anemia? Antibacterials, chloramphenicol sulfonamides, anti-inflammatory or anti-rheumatic agents, phenylbutazone, oxyphenbutazone, gold salts, indomethacin, anticonvulsants, phenytoin, methoin, diuretics, chlorothiazides, other thiazides. Antithyroid drugs, propylthiouracil, methylthiouracil, carbimazole, potassium perchlorate, thiocyanate. Oral hypoglycemic agents, chlorpropamide, other sulfonyl ureas. Psychotherapeutic drugs, chlorpromazine, chlordiazoxide, anti-malarial drugs, amodiaquine, chloroquine and mepacrine. And this study has been taken from Drug-Induced Aplastic Anemia and Agranulocytosis Incidence and Mechanism by Paul C. Vincent. Today I am concluding my video till drug-induced aplastic anemia, and in my later part we will discuss regarding other parts of the contents. Thank you.